Let's talk about back pain. Everyone knows everyone, don't they, or someone with back pain, with back problems. It's really common, and there's a new study saying 8 in 10 people actually have it but aren't treating it properly.
So do you know what kind of pain you have and what you should be doing to treat it? Well, Physio Fitness Australia Director Tim Keeley is here to shed some light.
Good morning.
Tim, good morning to you.
Good morning.
First of all, just explain why so many Australians have back pain.
Well, I think the stat they usually say is 90% of people have pain and 10% have forgot they actually had it. And a lot of people treat their back pain as something that will just go away. So they might pop some painkillers, or they will just sort of wait. And if it gets really bad, then they'll usually seek treatment after that. So it takes a long time before people actually do something about their pain.
But why? Do we all walk badly or sit badly, or are we just all cracking up? Or
well, the main three things that causing a pain at the moment is, firstly, is poor sitting posture. Okay, so if people sit for a long period of time, or if they stand for a long period of time with usually a weak or poor posture, that causes the pain. Mm-hmm. The second thing that happens is people are trying to exercise or do sport that they're not conditioned to, or they try and do something that they're not used to. And the third thing is just really poor lifting techniques. So when they try and lift something too heavy, or they lift it poorly and they do it after a repetitive amount of time, that's when the body breaks down and we start getting back pain. But usually all these three things are associated with weakness or tightness in the spine, or a lack of core strength in the spine, which usually brings on the pain. And in the end result, if you're getting older, it's the degenerative and trauma process that happens in the spine as well that inevitably gives you back pain.
OK, they're the problems. How do we treat them?
Well, usually the best thing to do if you've got persistent back pain is go see a physiotherapist for an assessment to see exactly what you need to do, and then you can get some treatment and the right exercise and right advice of how to fix it and how to prevent it. But today we're going to give you some simple exercises to do at home that are safe and effective.
OK.
That'll help everybody for all the 3 areas of the spine.
All
OK.
Right. Let's get into it.
So if we get Michelle, our physiotherapist here.
Hello, Michelle.
Hello,
How
Michelle.
are you? Nice to meet you.
The first exercise we're going to do is to look after the lower back, the disc health of your lower back. So this is a lifelong thing you can start working on. This is what we call a Mackenzie extension. And what you do is when you're on your front, you push up backwards, trying to breathe out and relax that lower back, pause for a couple of seconds, and then just drop down again. And you might do sort of 10 repetitions of that, and you might do a couple of sets, maybe twice a day.
OK.
Pretty easy stuff.
Right.
And that's a really good way to look after your lower back, to stop those lifting and sitting bad postures giving you that pain.
Now, do you have to tighten your core with that?
No, with this one you relax your core. Today is sort of more about stretching. The core, the strengthening stuff is very specific, and usually a lot of people are all different, so they actually have to get proper advice on what they need to do and what they need to work on.
OK.
But this is just a stretching.
What about
that's
mid-back?
For your mid-back, the best one to do, and this is great for those office workers, is to do it in sitting. So for Michelle here, if you're sitting, every, say, hour or so, she can try and put her hands together, reach over her head, and just arch in that mid part of your back. So that part where just sort of between your shoulder blades you're trying to stretch out and relax.
That cushion there, should we have that on all our chairs?
If you've got pain while sitting, you probably should. This is called a lumbar roll, and it just sits in that small curve of your back to try and increase the curve. If you don't have one of those, if you've got a chair that's got a really good lumbar support, that's pretty much adequate as well. But these are a great thing to have, especially in the car or sitting at the office.
OK.
Yeah.
All right. Good. Now...
It's moving up, neck.
The neck.
The neck. For most people, when they sit, they tend to poke their neck forward, and that's one of the big causes of the problem. So what you can try is, first of all, you need to sit up really straight. And then, if you put 2 fingers on your chin like Michelle's doing, what she needs to do is look straight ahead and just draw her chin away, just gently until they feel that tightness. Not the pain, but just the tightness. Yeah. And then back again. Be careful that you don't tilt your head back. You've just got to keep your eyes level and just draw that chin away.
Double chin, I don't want that.
Yeah, double chins, exactly.
So, should we walk around thinking of that too? You know, you say we walk around like that. Should we...
This is more about trying to do exercises throughout the day. Right. Everyone can sort of slouch and all that sort of thing every now and again, but it's the problem when you slouch all the time. So for these sort of exercises, it helps sort of trigger that, oh, I've got to get back up in that better position again. So if you can do these exercises throughout the day, it'll help with resetting that posture, getting back up into that upright position.
Tim, that's terrific. 3 great exercises. Thank you for that. Thank you, Michelle.
Thank you for coming.
Pleasure.
Good tips.